I found out when I was about 5 or 6, but I never really started to soak it in and learn about it until I was in middle school. That's when I really wanted to be like a normal kid, and I didn't have the opportunity. A lot of times, like I said, like I couldn't walk. I didn't want to be bothered. I kind of just wanted like my medicine, and then I'm like, leave me alone. Let me go through this by myself and deal with it.
When I come into the ER, I automatically have a fence on. I'm just like, okay, going in here, they're gonna think I'm addicted to pain medication. How do I convince them that I'm not addicted to pain medication and I'm not just asking for it just to ask for it?
I get chronic headaches that I still get for, I think, almost a decade now that I've been having the same headache. I know the hip pains, the joint pains, and everything else, that's like a stabbing pain. I can barely move at times. I mean, I get frustrated from it. It's very frustrating because no pain medication really works for me, so the pain is there. It's not something that you can ignore, but I have to ignore it just to get the day going.
When I'm having a crisis and it's 2 a.m. in the morning, I try to have a bin of snacks like right underneath my bed, so I'll grab crackers, eat a few, try to eat them really quickly, then chase it down with some water, and then go to my drawer, which is not that far from my bed. It's like 5 feet from my bed, and then start off with something soft, which is Motrin, and see how that goes. If I'm not feeling anything within like 45 minutes, then I move on to the hard stuff, like morphine, extended release or immediate release, and go from there. Usually that does it, but
if you are sick, you deserve help. If you say you're in pain, you deserve to be believed.
when I changed hospitals and I seen a girl with sickle cell, she was like just glowing, like literally. And I was talking to one of the doctors who was like, yeah, that's also my patient. And when she came in, she was just as little as you. And like, don't worry, we're gonna get you there. It's gonna take some time, but we're gonna definitely get you there.
She went from barely having a life at all to having quality of life. That's what I learned. That's what we learned. That's what she learned, that life wasn't just sickle cell. She began to live. She was doing things that I didn't know that she would ever amount to. I think that's what the last place didn't focus on, giving the patient enough quality of life. When my daughter was very young, I told her from the beginning, you're going to college, you're going to succeed, and you're not allowed to use your medical condition as an excuse for failure. It doesn't work that way. I told her as a mother, I told her as a social worker that the rest of the world is not really going to care. Your mama cares. Your teachers will eventually care. Your family members undoubtedly care, but the rest of the world is not going to care. So we got to figure out how to maneuver in this life. These are the cards that we have. We got to deal them. We got to play what we've been given. You're not allowed to use this as an excuse not to push forward. There were a couple of times she's in a hospital on a morphine drip, nonetheless, with a bolus button that she could control. And the only thing I could tell her is, once this is done, we're getting right back on that horse. Oh, okay, Mom, but right now I'm sick. I know you're sick, but not forever. This is just a day. This isn't your whole life. This is just a day. It's a bump in the road. We have bigger things to do. We have bigger fish to fry. Once this is done, back on that horse. And she's kept that. She's had a couple of minor crises, sickle cell crisis, while in college. She'd tell me about it like a day or two later. I'm like, what? What happened? How did you handle it? Mom, I just did what you told me to do. I did my deep breathing, and we started cognitive behavioral therapy so she could just start breathing through the pain. And once she figured out that didn't work, okay, we're going to try Motrin. If that doesn't work out, we're going to try the next thing, that's acetaminophen with codeine. Yes, I can actually remember that word. If that doesn't work, then you take it up to the next level, which sometimes meant morphine, extended release, or morphine immediate release. You do what you have to do for that moment. It's just a moment in time. It doesn't dictate what you do with the rest of your life. Once it's done, you get back on that horse, you get back on your school studies, you call your internship, you call your job, you let them know, I was down, I'm back. Let me know what I got to do.